Hey guys, welcome back to Harsh-Worded Tenderhearted. Trigger warning for today's episode. We are talking about very emotional, graphic, triggering things like pregnancy loss, DNCs, unplanned pregnancies that were then lost.
She's laughing. It's not funny, but coping.
It's not funny, but like I like that.
Yeah,
we've talked
coping
about that.
mechanisms.
Yeah, that humor is like a coping thing
yes.
for us. We filmed like a whole episode about me being pregnant, and I'm gonna keep laughing. It's like I'm either gonna laugh or I'm gonna cry, and I'm not crying on the internet like that, so I'm gonna laugh on the internet like that. But we filmed like a whole episode about me being pregnant, and like, oh my god, like it was meant to be, like all the stars like aligned for this thing to happen, and then I miscarried.
Mm-hmm.
And it was like, I think humor is such a huge coping mechanism for me that like literally before I even got home after the ultrasound where they couldn't find a heartbeat, I was like joking. Yeah. Like I was like, it knew it had no daddy, so it killed itself in there. Like, but again, like it's just like it makes it lighter and like easier to deal with when things are funny because we're such jokesters.
Yeah, I'm laughing because she's laughing.
Like I wouldn't be laughing otherwise. But yeah, so I was pregnant for 12 weeks ish, and I got pregnant unplanned. I had talked in that episode about like it was very weird because I have talked about my wild nightlife inside, like not like clubbing and stuff, but like my wild like activities and my fears and suspicions of being infertile. And it all kind of made sense in a way that it's like I was never super careful. I've been on birth control briefly once, like when I was like way younger, very, very briefly. Like I don't even think I finished a month.
Very briefly.
Very briefly. And I was actually watching a video of Tana Mojo the other day, and I like keep saying to myself, like, if Tana Mojo will say it on the internet, I'll say it on the internet.
Oh, okay.
You know?
Good indicator, I guess.
Right? It depends who you ask, but I've never had like, what are they called? Birth control that's like
contraceptives?
Like an IUD.
Oh, okay, yeah.
Yeah, like I've never had that. Yeah, preventative measures of sort. I don't use protection. Like I don't. It's like not a thing. I should have been, I think in my life, I also got my period when I was 8. I've been able to conceive since I was 8, so for the past 20 years. And with the lifestyle that I was living, the activities that I was involving myself with, I should have been pregnant 20 times over.
Yeah.
Like it just doesn't make sense. And then after I turned around 25, I kind of started to be careful in the sense of like timing. There still was no like preventative measures or anything, but like the timing of my cycle.
Like,
yeah. So like
you're more aware of your cycle.
I ovulate day 14. I don't know now, but like up until I got pregnant, I've ovulated on day 14 without fail every single time. My period is like to the minute. And
which is crazy.
I know. And I'm like very, very in tune with my body just because of like all the health stuff that I have to deal with. Like I've grown to be very in tune with how I'm feeling and like how everything's doing in there. And then all of a sudden I got pregnant, and it was like weird because I was being careful, and it was like day 15, which is like typically impossible if you've already ovulated. So for some reason that cycle I ovulated late. I don't know how that happened. It's never happened. Like I've had closer calls. I have like even ovulation is like down to the minute. Like I have like I have had sex the day that I've ovulated and
nothing's ever
had babies in me. Yeah, like there was nothing happened after that. So it was very weird. baby dad I'd been friends with for like 11 years prior, which was also very weird. Happened the night of his birthday, which was also very weird. Like it was everything was just so weird, and it happened at a time like the past year or so. Even on this podcast, I've been very open about like kind of accepting my journey, accepting myself for like and my life for what it is, and not trying to like force anything, push anything. And then all of a sudden, I got everything I'd ever asked for, and it was like, oh my god, of course I'm gonna keep it because it was weird. I considered not keeping it. Genuinely, like it was a conversation that I had to have with that friend because it was like not planned and not wanted on his side and not wanted on my side in that specific situation. Something that I've always wanted, but I've always like promised myself that I was never going to raise my kid without like the way that I was raised.
Yeah.
You know, like I don't have a dad, and that's like exactly what he said. Like he doesn't have a dad either, so it was very much so like we both kind of understood how it felt to have one parent. So the fact that he didn't necessarily for sure want to be there, it like raised all of these concerns of like, is this really something that I want to do, and is it something that I can do emotionally? Is it something that I'm going to feel guilty for the rest of my life? Kind of like you come from a broken family and then you make a broken family. Like I did not want that. And then I kind of like became comfortable with the fact that like everything happens for a reason, and like I'm confident in the fact that like from the work that I've done, I could raise this kid knowing no difference of like love, no matter how many people were around it, no matter if it had one parent, two parents, whatever. Like I was very confident in the fact that I could make it work. So I decided to keep it, which at that point I had to grieve an 11-year-long friendship.
Yeah.
Because at that point now, like there was no really like communication kind of stopped. Like there was no, there was
he
a lot
didn't
of,
want to be involved. Yeah.
Yeah,
It
there
was
was
either
like
keeping it or keeping him.
Yes.
Yeah.
And there was like a lot of anger on both sides. There was a lot of like sadness and confusion on both sides. And he was kind of like in and out at a certain point until it was just like too much. And then I just kind of tried to be okay with the fact that like this is what's happening. I'm doing it. And I like did the prenatal care that was required of me. Like I called the doctor, I did my blood work, I did my ultrasounds, whatever. I had my first ultrasound at 8 weeks, and a couple weeks later, I think it was around like I was 9 or 10 weeks, I had a phone call with a nurse at my doctor's office. She said I had a subchorionic hematoma, which, number one, is something that I didn't know about before I was pregnant. And I guess it's very, 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 very common. There's really no cause for it. There's nothing that you can really do to prevent it or like whatever.
Like
it's just it happens.
Not a lot of known risk factors or anything.
Yeah. It just kind of happens. It's very common, and like any doctor will say, you do any type of research, most pregnancies go on to have a healthy delivery, and that's it. And there's complications that go along with it and like symptoms that go along with it, but like I was fine for the first little bit, and then all of a sudden I start like bleeding. And I like that day was so unbelievably scary because I had like spoken to the nurse, and the nurse was like, I wouldn't be like, she said she wasn't concerned. She said, don't be concerned. If you have bleeding, like let us know, but like it's small and like I don't see anything wrong. It usually resolves on its own. And I'm like, okay, cool. So then obviously like I don't trust doctors because I've talked about how my doctor wants me dead.
Yes.
So I go on this deep dive of like research and stuff like that. And I scare myself a little bit, but like I think it was like a good thing that I was like cautious.
Yeah.
Because they said like pelvic rest, stuff like that, but like I was working out at the beginning of my pregnancy. And it's like I knew enough after my research to kind of like take it a little bit easier at least.
Yeah.
Whereas like if I just listened to my doctor, I would have continued working out. I don't know what would have happened, but it's like whatever. But it was a very, very stressful pregnancy with everything considered. Carrying a child is also not that magical and glamorous as it seems. I kept saying like it was actually pretty easy. Like it went really well. I didn't have a lot of issues other than the hematoma and the absent baby dad. But like compared to other people's pregnancies that I've seen that I know, like I'm thankful for how it went when it was a thing. But like I was very comfortable with that being an only child. Like I
Yeah.
was like, oh, I don't want to ever go through this again. Like the way that your body, especially like we're very like active and like we
Yeah.
like to have fun and stuff, and like the way that your body changes and like the way that you feel, like, oh my god, I was like, I'm cool with one. I've always wanted 10 kids, but when I was pregnant I was like, I'm cool with one kid. This is cool. Like I'll adopt after this if need be. But the hematoma started to like cause problems. I started to bleed, and I like went to urgent care. Everything was fine. um there was a large fetus in me, um like bigger than normal. Like ultrasounds, I watched it like waving and like rolling around, like bouncing side to side, and I watched its heartbeat. That was on a Sunday, and then on the Monday the bleeding stopped. Tuesday I started bleeding again. I called my doctor. They said to go back to urgent care. I went back. Same thing happened. Blood work. Nothing else was wrong. No UTI. No, um, nothing else. We did an ultrasound, but watched the heart beating. And then by Friday, I had a scheduled ultrasound already, and it was just my 12-week ultrasound that like everybody has.
Yeah, your routine.
I don't remember what
Routine
it's
one.
called, but when they like check for chromosomal.
Defects and
Yeah.
stuff. Yeah.
Um, and by Friday afternoon, there was no heartbeat. So on Tuesday at like 4 p.m., I watched my baby's heart beating inside of me. And then on Friday by 3 p.m., it was dead. Which is like so weird and like so fast. I almost kind of like wish that I didn't see it on the Tuesday,
Yeah.
because it was like what the hell
Yeah.
happened, like within those literal 2 days that like it died, right? So like on the Wednesday I woke up with a fever, and I had felt like so sick, but not like sick to my stomach. Like I was just, my whole body hurt, and I was like shaking and shivering and cold and hot at the same time, and I had a fever, and like just like my bones hurt.
Mm-hmm.
And I was like, I had to call my mom, and I had her leave work to bring me Tylenol, and I looked her dead in the eye and I said, something's wrong. But at urgent care they were very like, the doctor on Tuesday was like, don't come back unless you're filling a pad every hour for 3 or 4 hours consecutively. And I'm like, okay. And I wasn't until after the Friday I had found out that I had a miscarriage. But so like I didn't go back. And like looking back on it now, I really had to convince myself that like I didn't have to go back, because like even if I went back, what were they gonna do?
Yeah.
It's not like they could have taken it out of me and put it in the NICU. Like it was 12 weeks old inside of me. Like it's not like they could have saved it regardless whether I went or not. I think I just would have found out sooner.
Mm-hmm.
So I dealt with that, like not my fault, like nothing I could have done different. I had stopped all of my bad habits. Like they, as soon as I found out I was pregnant, I went through the awful cycle of quitting vaping. That was the worst thing ever. So much so that like no matter how stressed I am right now, like I can't even pick it back up, because that withdrawal was absolutely insane.
Yeah.
It was worse than the weed. I stopped smoking weed as well, and that was a lot easier than I thought it would be. I stopped caffeine. I used to drink multiple energy drinks a day. I haven't had, the most caffeine I've had the past
Tea?
3 months is a tea or an iced tea. I think I had a French vanilla at one point and it ripped my stomach apart. And like if it was weird, because like the when all the guilt kind of came in after, I was like, I tried so hard to do everything right,
Mm-hmm.
and it still
Happened.
happened. um and then on the Friday I went to emergency because I started like passing tissue and stuff like that, and they referred me to this pregnancy loss clinic. And the way that like the hours that they work and like stuff like that, they couldn't get me in until the Wednesday. So Saturday, Sunday, Monday, Tuesday, I was just at home waiting. And I was like advised the same thing. Like if I have a fever, if I'm like feeling a pad too much, whatever, go back to emergency. But I just kind of waited it out. And I am like not even kidding. That was the worst pain I have ever felt in my entire life. I like think about it and I can't decide if I'd rather like have a gastritis attack or like the pain of a miscarriage, because like they're so neck and neck. But like I think with the gastritis attack there's some relief once I throw up,
Mm-hmm.
but there was no relief. Like it was like I was like doing research after again too, and it was like a lot of people compared it to actually giving birth. Like your uterus contracts. I'm laying there and you have contractions because now your body is trying to, regardless of how big the
push
baby is,
whatever
push
it
it
is.
out. Yeah. And like obviously you're just sitting there contracting for days. It's not like as much as it's not as big, you don't dilate as much, like you don't have a chance like get an epidural, or
Mm-hmm.
like you don't have like you're taking Tylenol and it's like that's it. I can't take Advil because, or like naproxen or anything like that would have helped better because I have stomach issues. So I was just reliant on a heating pad and a Tylenol and sleep. I slept a lot, and like it was like the pain is just was like genuinely debilitating. Like I can't even explain it, and I would not wish that like upon anybody that is on this planet, because like it hurt so bad that like I forgot I was miscarrying most times. Like I couldn't even think about the fact that I was
Whoa.
miscarrying or anything else, because it hurt so bad that my brain would shut off. And like I didn't know why I was hurting, but I knew I was hurting and hurt. Like I couldn't stand up, I couldn't walk, and I was just like crying and crying, but because I was in pain.
Mm-hmm.
Like I wasn't even thinking about anything else, or the fact that like my body was trying to pass a fetus and a placenta and tissue and stuff like that. All I could just think was like, oh my god, like I need this pain to stop.
Yeah, it was like
I need,
blinding.
yeah, I need this pain to stop. And I ended up delivering the fetus and most of my placenta at home on Tuesday in the toilet. Home alone, which was so scary that I started laughing. Like
On the
I
toilet?
like, pardon?
On the toilet?
Yeah.
Oh.
Like I couldn't even, like I was in so much shock, and like my emotions were all so mixed up and high that like I couldn't even like cry, and I just like started laughing because I was like, what the fuck is happening?
Mm-hmm.
And it's like it was so, I don't want to use the word bittersweet, but like I can't think of another word, but like there was relief
Mm-hmm.
in my body, like physically, as soon as it came out. There was like I felt like, I talked about it with the doctor at the pregnancy loss clinic, and she's like, that's how it goes. Like it's like mimics labor a little bit, where like you're contracting and you're contracting, it hurts so bad and you feel like you need to push, kind of like you have to take a shit.
Mm-hmm.
And like your body's not giving you another choice. Like you need to push. I need to push. I need to push. I need to push. So you push, and then as soon as there's the release, the feeling that you need to push goes away. So it's like there was physical relief in my body, but I was like, oh my god, like it's out of me, like it's gone.
Yeah, like the
it's,
emotional side, yeah.
yeah. So it was like, it was so weird. I almost like wished for the debilitating pain back.
Oh.
Like it was such a weird thing to happen and to go through. And like I think regardless of whether like people are alone in their pregnancies or they're with their partner or they have support or whatever, like genuinely it was the most awful thing I've ever had to go through in my entire life. And like I feel so hard. Like sometimes I'm sitting there and I'm like trying to accept the fact that I miscarried, but I'm like bawling my eyes out because I know that there are other women right now going through the same thing. Like it like I like, to the point that like there's certain organizations and stuff that were given to me as resources through the hospital and stuff, and like there's one that is like, they're not actual counselors, but there are people that went through miscarriages themselves. And I'm like, how do I join this thing? Because it's like, it's genuinely like I cannot believe that people have to go through that. I cannot believe that people have to go through that more than once. like I'm so scared to get pregnant ever again because of that experience. Genuinely, like I don't even, and this is coming from somebody who's like wanted to be a mom since I was a baby. Like this is everything I ever wanted. Like the reason that I'm put on this earth is to be a mom, and like whatever, I want 10 kids. I'm genuinely so unbelievably scared to be pregnant ever again because of the chance of miscarrying again and how common it is. I don't think there's not enough awareness of how common it is. Um, I was even telling, like, I was talking to the baby dad about it prior, about like how I was kind of scared because of one, my age, two, my activities that I like all of the
and
things
just how
that
reactive
I
your
do.
body is in general.
Yeah, like I was just kind of like, okay, like this is a possibility. And I knew that. And even though I knew that from the start, like it didn't make it any easier to deal with, especially because you don't really know what to expect.
True.
I remember talking to the nurse at the pregnancy loss clinic, and she was like apologizing. I don't think I ever want to hear somebody apologize, first of all, for the rest of my life. Like for days and days, it's like I met like 80,000 people, just like doctors and nurses, and like the amount of times I've heard like, I'm so sorry, this must be so awful for you. Like I'm like, yes, like sorry is not going to bring my baby back, and it is awful, you know, like it's like I'm sorry, like I appreciate it, but like I cannot hear those words again. And I was talking to the nurse, and she had said, like, she was like kind of bashing the system in the sense that like you don't really get educated until it already happens, or you don't get the support until it already happened. She's like, I really wish we could have gotten you in sooner before you delivered at home, because it's like at that point she was just kind of like confirming everything that had happened.
Already happened, yeah.
But there was like no preparation for it. And it's like it's worse than you think. And I was talking to my one friend, and I I didn't know, but I guess like one of our friends miscarried before. And when I was telling her that I miscarried, it was like the exact same thing too. It was a miscarriage, so the baby's heart stops beating inside of you, and your body has yet to expel everything. And they were saying that like everybody in that group that they had like kind of talked to after it had happened, everybody had actually gone through the same thing.
Oh, really?
Yeah. Like she was like, every single girl I had spoke to after the same thing happened with their first pregnancy. And it's like you don't realize how common it is, no matter how healthy you are or like anything like that. Like, yeah, there's all these risk factors of like, if you do this, you increase your chance of miscarrying. If you're like this before pregnancy, like whatever. But it's like you can do everything right, and it
still happens.
It still happens, and it still happens in the most awful way that you could like ever imagine. Like it doesn't give mercy to anybody, you know. Like it's just like that's how it goes. And by the time I had my appointment at the pregnancy loss clinic, I like spoke with the social worker and stuff like that. They had done an ultrasound again, and there was still some of my placenta in me and like tissue in my cervix, which can become septic and be this whole thing. So they gave me the two options of like the medication or the surgery. And I had never been a fan of the medication, even like when I was honestly considering abortion. I had always favored the surgical route because of my reactive body and my digestive issues. I just was not okay with having the medication. That was too risky for me. As much as surgery is more invasive, it's more quick, and it's more of like a guarantee that like more under control. And they gave me the same two options of a medication, and honestly, like I know people who have taken the medication, and I just couldn't imagine. Like I was crying, and I was like telling her, I want this to be over, I want this to be done as fast as possible. Which they were very good about. Like there was no pushing of like either side. They were like very understanding of the fact that like I had been going through a horror movie for the past 10 days. Like I want this to be done. But I can't remember what it's called, miss something, but like there's the medication allows you to continue laboring at home for 2 to 4 weeks. There is no goddamn
that's crazy.
way.
That's a long time.
There's no goddamn way I was going to go home and continue that pain for 2 to 4 weeks. Like, no, just for it to like, no,
Yeah.
no. Um, my blood work did come back a tiny bit concerning in the sense that my iron was very low and my like red blood cells or whatever were low. So she was a little bit concerned about me even taking the medication and then ending up like bleeding out.
Yeah.
At home. So we just all were kind of like, hey, we're gonna do the DNC, and they got me in for the DNC the next day, and I went in. They put me under. They talked about conscious sedation, and I was like, no.
Was it a general anesthesia then, or
Yeah. They just put me under because I refused. I was like, no. I've been living a horror movie for 10 days. I'm so emotional. I'm not going to be. My eyes are not going to be open when you're taking the rest of this shit out of me. Like, absolutely the fuck not. And like it was so fast. I've had surgery before. That's what they kept saying. I was like bawling on my way to the ER or OR while they were like wheeling me. Everyone kept saying, "Is this your first surgery?" I said, "No." That was like I think the 4th time in my life I'd been under general anesthesia. I don't have a problem with it. It doesn't like scare me or anything like that. But it was just the fact that like this was like the final step, I think.
Yeah.
And like kind of like ending it. And I was like bawling and like they pushed me into like it was so weird too because like I've never had that big of a team in a surgery. Even my ear, like I don't remember my team being that big. No.
How many people?
There was like 10 people.
Oh, that's a lot.
There was a lot.
That's a lot because even usually like in class when we're talking about it, because like RTs are involved in like OR.
Yes. Yeah.
Even for like
I didn't get to meet my RT, which was weird. I met every other person. They all came out and everything. I met like the anesthesiologist student that was working, but like the RT didn't say a word to me.
Oh. Wait, so you had an RT?
Yeah, because I had to have the breathing tube and stuff like that.
Yeah.
But they didn't. They were the
that's
only
weird.
ones.
That's weird. Yeah, but we were talking about it in class because one of my professors is an OR RT.
Okay.
And then he's like, no, like usually for most surgeries it's like 6 to 8 people.
Like I remember when they cut my ear off when I was a teenager. Like I don't know if they had like put me to sleep sooner. But like they didn't put me to sleep until I was like on the operating bed. So like I'm like everybody, I'm like bawling. I don't have my glasses on, so I can't see a single thing.
Oh my gosh, you're blind and you're crying.
And they just had everybody kind of like come out of the OR and introduce themselves to me. So like the gynecologist came out,
nice.
So sorry, whatever, blah blah blah.
Yeah.
It's supposed to be so awful. And then the anesthesiologist came out, all the nurses came out and like introduced themselves to me. I'm like, can't even look people in the eye because I'm so blind without my glasses. And it was so fast, and I'm like, are you guys gonna put me under? And the anesthesiologist says, yes, we're gonna put you to sleep. And I say, okay. And all I remember is like going in and like the look of like everybody was rushing. It was, I swear to God, an episode of Grey's Anatomy. Like it was so scary. Everybody was like running around and like rushing, and there was like 10 people in there. I had only like been introduced to like half of them. They're like trying to get me on the other bed, and there's like something on the bed to like hold my leg. Like I don't even fucking know. I'm like bawling, and like there's people on this side. The RT was on this side trying to like rip this, like open this part of my gown, and then this person was trying to open this part of my gown, and then there were people like fucking whatever, and then everybody's talking to me at once, and then the gynecologist is like, we're just gonna talk about you for a second. So this is Natasha.
Oh, they did their pause. Yeah.
And I'm like, oh my God. And then I look at the anesthesiologist and I'm like, I'm sorry, I can't calm down. And that was the last thing I remember. And he was like, it's okay. And then I look over, and then the RT's putting a mask on my face.
Yeah.
And that was the last thing I remember. And then all of a sudden I hear like, Natasha?
Like when you woke up?
Yeah. Oh. And it was an angel of a nurse waking me up in recovery. Thank God. I only had like one person that entire day that was kind of like standoffish and like very.
And it was the RT.
No, actually, it was one of the nurses in recovery that took over for the other one. I didn't even like meet the RT. I was kind of excited to meet the RT because Kai's in an RT program, but they just put the mask on my face and put the breathing tube in, whatever. But
I wonder if you got intubated or if you got LMA'd, because usually for like it's not like an actual breathing tube that goes like into your like breathing trachea. Usually for like not elective surgeries, because well, technically. Anyways, for usually for like some surgeries like that, they just put like it's a tube, but it has like an inflatable thing that looks like an ear, and
Ew,
it
what
sits
the
above. It sits above your vocal cords and like your esophagus, and then it's like less traumatic to your vocal cords,
weird. Well,
but
okay,
it's a
so
less definitive airway. So
everybody
I was
kept
like, I
saying that my
wondered.
throat was gonna hurt after. It didn't at all.
Interesting.
But I kept needing to spit after. Like
I
as
wouldn't know
soon
about
as I
that.
woke up, I was like, I need to spit to the nurse. So she like had that like dental tube
Yeah.
thing, that was the suction,
The suction.
and she had to do it like 4 times because I was like, I'm sorry, I need to spit again. Like I just kept needing to spit, which was weird, but my throat didn't hurt at all. Like I didn't even know
Interesting.
that I
Maybe you
had
did get
a
LMA'd
tube in
then.
there.
Interesting.
But
Those
yeah,
are on my
so
test. I was recently just on my exam for that.
that's
Putting a tube in, yeah.
crazy. You know what? I do think you would enjoy being an ORRT though. Oh my god. Like it was very interesting. It sucked that I was on the bed. Like, oh my god. And it's never been like that fast paced.
Yeah.
I was like put under when I had an endoscopy, but like that you don't need a huge team for that. Like, oh my god, it was crazy.
Yeah.
But and the walls
Was
were
it your
so
first
white.
one at no, well, I guess both of the hospitals here, both of the major hospitals are teaching hospitals, because I was like, they probably just have like a whole bunch of extra like people there because it's a teaching hospital.
That's true. That's true.
Yeah.
Very, very true. But it went well. It went very,
That's
very
good.
well. I didn't like I'm still kind of living off Tylenol because I'm like this happened 3 days ago. Like I'm still like cramping and stuff, but I'm not like bleeding anymore. I am oddly enough right after it happened, like right after I woke up, I cried for a little bit, and then I was like, I want to go back to work on Monday.
Mm.
Like it was.
Yeah, but you're like that.
right?
Yeah.
It was just very like, okay, this is done,
yeah.
this is over with. Like if I move on or I let it kill me.
Yes.
And I kept saying that because like I ended up letting baby dad know that I had miscarried, and we spoke the night after I had the surgery, and the day after, and like all went well. Like we're both kind of like very weird with each other still, obviously, but like he was saying that like he was scared of the aftermath. Because like he genuinely thought I was going to kill myself, and I thought I was gonna kill myself.
I thought you were
too.
going to. I was very scared. I was very nervous. And I had like just come out of an exam too when you texted me.
Oh my god!
So I was like, oh my god, thank god she texted me after the exam.
No, like I was very scared, and I think
For the whole weekend, I was like, oh my gosh, like I need to check in on Ashley. But then I was like trying to study, and I was like, I need to text Ashley. And I kept doing that thing where like I text somebody in my head, but not in real life.
yeah,
And I was like, I wonder why she hasn't responded yet. And then I'm like, you know what, she's probably going through it. But then meanwhile, I just didn't text.
oh my god, I was just like I was very numb throughout the whole thing, and then like after it happened, I think I was so exhausted, and I was just kind of like my brain just started going into that place, thank god, of like you live with it or you let it kill you. And I was like, it wouldn't make sense for me to say that the pregnancy was meant to be and I got pregnant, because like everything happens for a reason, and not think the same thing of this. So like I kind of had to like force myself to go into that spot of like, if it's meant to be, it'll be, if it won't, it won't. And it didn't. So it must not have been meant to be.
Yeah.
Like it had to have been protecting me from something. And I'm like very, very eager to like get back to the gym and like stuff like that for some reason. But I also just kind of like let myself cry hard when I need to, and let myself feel through the emotions. The social worker is very impressed with me. I had to like
Oh really?
tell her that I've been fucked up my whole life.
Yeah, you're like,
and,
I've been in therapy since I was a child.
like even like the words I was using, she was like, and I'm like, yeah. But yeah, I think we definitely need more miscarriage awareness. Like I've like all the people that are like going around talking about abortions and like showing those pictures, they should be spreading awareness about miscarriages. Because of what the fuck.
Yeah.
Like it's so common and so hard, and everybody deals with it differently, and it's just like one of those things that like you will never expect, but it can happen to anybody no matter what, and that it's normal, and that it's like okay. And genuinely, like no type of birth control ever worked on me ever. I have watched births. I used to be obsessed with the baby story. I took parenting. They could have sent me home. I've heard that joke, like, I wish parenting class sent me home with the deadbeat baby dad. That would have worked better. But a miscarriage, preparation for a miscarriage, would have worked the best.
Oh my gosh.
Genuinely.
Yeah.
Oh my God. Because it's working now.
Oh.
It's working now. Now I'm like, oh my God, I never want to get pregnant again. But we're getting through it. But anyway, that is all that we have for today. Thank you for watching and or listening.
Make sure you're following us on all of our socials at Harshworded Pod.
If you're watching on YouTube, make sure you like, comment, and subscribe, and we'll see you next week.
Bye.
Bye.